Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of December 2025 and January 2026 includes stories about exceptional Radi faculty learners who were recently awarded the Dean's Prize, a new research study on the results of child removal by Child and Family Services on the mothers, and a multi-faith center opens on Bannatyne campus, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. The Dean of the Radi Faculty of Health Sciences Graduate Student Achievement Prize was awarded to 9 outstanding learners in 2025. The award recognizes exceptional academic achievement, strong leadership skills, and notable personal service of grad students in the Radi faculty's 6 colleges. Ashley Bell is one of the 9 Dean's Prize recipients. She was a master's student in the College of Nursing. Bell's research used arts-based methods to explore the experiences of 2S LGBTQIA+ parents whose babies were cared for in the neonatal intensive care unit. She said winning the prize was a special way to end her master's program.
So winning this prize has been a source of affirmation that I'm on the correct path towards a future career of engaging in research. I currently work with Dr. Roberta Woodgate as a member of her Engage research team, and my eyes are set on pursuing doctoral studies in the future.
Ashraf Kadar Shahib, a PhD student in biochemistry and medical genetics, was one of the Max Rady College of Medicine's nominees. His research is looking at how changes in a brain protein called MECP2 can cause problems in how brain cells work. He said winning the Dean's Prize reinforces his confidence in pursuing a research-driven career.
Receiving this prize is definitely a great milestone in my academic career. Most importantly, it is a signal that I'm currently on the right path, but I have to keep doing more. And pretty much, as we all know, with recognition comes more responsibilities. So this recognition has only given or has proven that I should be more responsible in the research that I'm doing.
Mothers who have had their children removed by Child and Family Services have an increased risk of dying prematurely, and this risk of death is higher for First Nations women. Those are the key findings of a joint study by the Assembly of Manitoba Chiefs and researchers. The study team analyzed government health and social service data for a 24-year period. It showed that in Manitoba, more than 1 in 4 First Nations mothers experienced child removal. These mothers then had a significantly increased mortality risk. The leading causes of death for mothers after their children were taken away include suicide, accidental poisoning, and homicide. Study leader Dr. Kathleen Kenny, a postdoctoral fellow in the College of Community and Global Health, said Manitoba has the highest rate of child apprehension in Canada, and child removal contributes to trauma that shortens women's lives. Grand Chief Kyra Wilson of the Assembly of Manitoba Chiefs told Global News that the study confirms the harm caused to mothers.
It's really information that we've known for generations. It's really ultimately started from the residential school system. We now have the child welfare system that essentially is doing the same thing.
Wilson called on government to work with First Nations leaders to reform the system.
Right now, we see a provincial system that has been broken since day one. The system has set our families up for failure. We've essentially been ground zero for child apprehensions.
Wilson and the study team called for solutions led by First Nations to support and preserve families. A new space has opened on Bannatyne campus for members of the Radi faculty community to practice their faith, explore their spirituality, or simply pause and reflect. The new Bannatyne Multi-Faith Center is located on the lower level of the Brody Center in room 078, and it is open to faculty, staff, and students of any faith. The space is operated by Spiritual Care and Multi-Faith Center, which opened a similar space on the Fort Garry campus in 2022. Edgar French, spiritual care coordinator for the university, said the goal since the spiritual care office opened in 2017 has been to establish multi-faith centers on both campuses, but it took some time to find the right space on Bannatyne. French said that once found, the space was assessed for the ease of access and usage by people of various faiths.
One of the things that we did in terms of renovating it is that we've installed what's called ablution spaces. So for Muslim members in particular, they need to wash before they pray and engage in ceremony. And so that's built in. The space is open and it has furniture for gatherings of all kinds. We have generous storage for sacred texts. We have yoga, prayer mats. So we've really designed it as well so that it's a spiritual space, and you note some of that with the particularity of furnishing and paintings, but it's neutral in the sense that there's no specificity of which spiritual tradition made. It's something that really communicates everyone is welcome.
A dedication ceremony was held for the space in December, with speakers representing various faiths from across the faculty and UM. Prabnor Singh, president of the UM Students' Union, said he is grateful that the center has opened.
Whenever I come in to the Bannatyne campus, I feel like the space would be the place where I can come in for a moment of reflection, mindfulness, or just meditate for a bit even. Because there's always something happening in life and you just really need to take a pause and reflect on your own actions, as well as give yourself space, time, and energy.
Most people wouldn't think of art as a way to explore chronic illness, but for Jen Sebring, a PhD candidate at UM's College of Community and Global Health, art became a tool to understand and support people living with chronic health conditions and disabilities. Drawing from their own lived experience, Sebring brings first-hand insight into the challenges of chronic illness. Their research focuses on functional neurological disorder, or FND, a condition that causes neurological symptoms without a clear medical cause. Sebring spoke with CTV News Winnipeg about their research and experience with FND.
Yeah, I think my own journey really reflects, kind of the issues that we see systemically with folks in the community. So my experience was, a long haul to get a diagnosis. There was a lot of ruling things out, but not really any clarity on what was happening or what treatment looked like. So it was about 4 years before I got a diagnosis. And then even then, I had to kind of piece together my own treatment because treatment pathways don't, currently exist in Manitoba, and they're kind of scarce throughout Canada. So that's kind of these compounding barriers are what we're seeing, across Canada and worldwide with FND.
Sebring launched undoingdisorder.ca, a website featuring artwork created by research participants. It's designed as a resource for healthcare providers and for anyone wanting to better understand life with FND.
Yeah, so this website stems from my research. I did interviews with 24 people living with FND across Canada, and then a portion of them completed artwork to kind of better understand and also communicate their experience. So I'm hoping that it can reach both the general public and also be a resource for healthcare providers and trainees to get kind of better insight into what that experience is and the kind of stigma people face. And hopefully, I just find art to be a very powerful tool for, understanding experience. So I'm hopeful that this can serve as a platform to kind of build that momentum.
Dr. John McGavick, a professor and researcher at the Max Rady College of Medicine, is launching the second season of the Emerging Scholar podcast, a program designed for graduate students, medical trainees, residents, and fellows to help them on their journey towards their first scientific project. Here is Dr. John McGavick to explain what you can expect from Season 2.
Last season, we took you on a journey through your first year of research training, covering everything from crafting great research questions to understanding the foundations of both quantitative and qualitative methods. We met incredible scholars, explored fundamental concepts, and built a roadmap to help you navigate your early research career. This season, we're going deeper. If season 1 was about laying the foundation, season 2 is about mastering the craft. We're taking those methods we introduced and really unpacking them, diving into the nuances, the challenges, and exciting new possibilities that each method has to offer. Throughout this season, you'll meet a remarkable team of both established and emerging scholars with expertise across a diverse array of approaches. From natural experiments that reveal causal insights into real-world settings to qualitative inquiry grounded in social justice, the complexities of implementation science, and yes, my personal favorite, causal inference. Each episode will introduce you to researchers who are pushing the boundaries, asking bold questions, and making novel and important scientific discoveries. First, we're celebrating Canadian research excellence, showcasing incredible work happening right here at home. Second, we're emphasizing the critical importance of patient engagement in shaping research that truly matters across a range of scientific methods. And finally, we're championing curiosity, the essential spark that drives all great science and keeps us asking, what if and why?
The Emerging Scholar podcast can be heard on Spotify and Apple Podcasts, as well as umfm.com. The new head of the Respiratory Therapy Department at the College of Rehabilitation Sciences comes with a unique distinction. He's been recognized by the American Association for Respiratory Care as the first person in the world to hold 3 degrees in respiratory therapy, including as the first with a PhD. Dr. Jithin Sridharan started his 5-year term in November. He said that UM is the only university in Canada offering an English language bachelor's degree in respiratory therapy, which makes it an ideal foundation for developing advanced programs such as a master's or PhD. Sridharan said one of his plans as department head is to raise awareness of the profession, as there is currently an unprecedented demand for respiratory therapists in Manitoba and across Canada.
One of my top priority will be capacity building. So that means expanding the student intake, which is already in plan and it's going on. But I would like to maintain an excellence in education along with the expansion. I would like to, be an ambassador and advocate for increasing the resources, our simulation space, clinical placement opportunity, which requires to be revisited. Strengthening this partnership with the clinical and other healthcare institutions around Winnipeg and in Manitoba province as a whole, and make sure our students are really practice ready and ready to take up the challenge.
Thanks for joining us today. Radius is heard monthly on UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radiomarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our new UM Today news site at umtoday.ca.